Good afternoon, guys. Watch me carry out this procedure. This procedure is known as gestational age estimation using tailors tape. What am I saying? Using tailors tape to be able to tell how many weeks of pregnancy your client is with. Okay? As a midwife, it is not all the time that your antenatal mother visits you. You send them for scan or ultrasound, okay, for you to know how many weeks of pregnancy they are with. So with my tailors tape, I'll be showing us how to estimate or detect how many weeks she is. Before you carry out this procedure, you first of all explain this procedure to your clients. Then you gain their consent. Ask her to go and empty her bladder. That is, let her go and urinate. Because full bladder can bring errors to your measurements. Okay? After she must have emptied her bladder, you create privacy for her. You ask her to lie down flat on your couch, like my client is doing now. After which, you give her lapper to tile, okay, to cover the lower part of her body. Then you ask her to flex her leg slightly. In this procedure, we measure from the symphysis pubis, up to the fundus. What is symphysis pubis? Symphysis pubis is the joint that connects the two pubic bones together. How do you locate the symphysis pubis? You locate the symphysis pubis by palpating from the lower abdomen down to the pelvic area. The first strong bone you will meet at the pelvic area are the mons veneris. Mons veneris is the part of the external genitalians that hair normally grows. Okay, so the first resistance that your hand touches here is the symphysis pubis. Now, it is there that you will now measure up through the abdomen to the fundus. Where is the fundus? The fundus is the uppermost part of the uterus. Like this abdomen now, inside of it is the uterus. Okay? Now, the uterus now, where it actually stops, whether it stops here or is stopping here, the uppermost part of the uterus, okay, you have to palpate the abdomen from the upper part down to where you will now see resistance. Okay, that place is the uppermost part of the uterus, that is the fundus. Okay, so in this my client, here is her fundus and here is her symphysis pubis. Now, with the use of my tailors tape, you will measure with the side that they wrote centimeter and not in meters. You measure with centimeter. Okay? If you get your tailor's tape, you see where they wrote centimeter. That is where you are going to use. Now, you start measuring from 0 to wherever you feel resistance. Okay? This is my client's symphysis pubis. You place it there from the 0. Then you measure through the ridges of the abdomen up to where you see resistance. Then you measure to the fundus, just like I explained. Now, my client is 30 weeks gone. How did I know? All these numbers that are written in centimeters, each number is equal to number of weeks of pregnancy. For example, if you measure 21 centimeter, that 21 centimeter is equal to 21 weeks of pregnancy. If you measure 12, it is equal to 12 weeks of pregnancy. It depends on where your fundus is located. It depends on where you see resistance, which is the fundus. Okay? So, after which you do your recording. This procedure is done at every antenatal visit in order to help the midwife to be able to detect how many weeks of pregnancy her client is with, and also to be able to know when the baby in the womb is actually growing and when they are having retarded growth. There are some landmarks you need to know offhand as a midwife, and those landmarks are when a woman is at 12 weeks of her pregnancy, okay, the fundus is at something a little bit above the symphysis pubis. Should in case if your tape gives you something different from what I'm saying now, okay, a woman who is at 12 weeks of pregnancy, her fundus is a little bit above the symphysis pubis. At 16 weeks, the fundus is a midway between the symphysis pubis and the umbilicus. The umbilicus, that is otuboya. Okay. Then at 20 weeks, the fundus should be at the umbilicus, immediately at the umbilicus at 20 weeks. Okay. Now, at 28 weeks, it should be above, the fundus should be above the umbilicus. At 36 weeks, the fundus should be located at the xiphisternum. Where is the xiphisternum? The xiphisternum is the space before the lips, okay? Before the sternum bone, okay? The middle of here is the xiphisternum. That is at 36 weeks. Then at 40 weeks, the fundus should be below the xiphisternum. Do you know why a woman who is 40 weeks pregnant, her fundus is below the xiphisternum, but at 36 weeks, it is at the xiphisternum? It is because of engagement of the head. Because when a woman reaches 40 weeks, the head engages down to the pelvic wall, thereby giving some space here. That is why a woman who is at 40 weeks, is fundus in measurements, her estimation is lower than the woman who is at 36 weeks. Okay, these are the landmarks you are supposed to know, so that when measuring, it will help you whenever if your tape is telling you lies, you'll be able to use these landmarks to put yourself to some corrections. If you find this video interesting, please share this video for me and touch my follow button. Thank you.